We're going to be talking about the use of plant-based lipids of high volatility in the medical practice. And this is about the treatment or prevention of disease by the use of plant-based high volatility and tissue penetration lipids, also known as essential oils. The first medical textbook, almost 2,000 years ago, written by Dioscorides, mentioned the use of 200 plant-based high volatility oils to promote health and wellness. So this has been going on for a long time. This was the precursor to the first pharmaceutical textbooks. So that's how this has been used for many years. The chemical properties of these lipids are mainly attributed to the monoterpenes. The monoterpenes are chemically two molecules of C5H8, which is 5 carbons and 8 hydrogens. You have 2 of those, and that's a monoterpene. And they have a role in plant defense against other predators, disease resistance, attraction of mutualists like pollinators, like bees, and plant-to-plant communication. So these are very important in the plant's survival and thriving. They also have to do with self-growth modulation, growth, light harvesting, and photoprotection, membrane permeability, and fluidity control. Examples of these are Taxol in chemotherapy are also terpenoid molecules. And they have other properties that we will discuss today that are very interesting, like anxiolytic when they're inhaled by stimulation of the olfactory nerve and subsequently the midbrain, areas like the thalamus, hypothalamus, amygdala get stimulated by these lipids. For example, citrus oil, citronella, orange, and geranium have been shown in randomized studies to be anxiolytic. So I've been using them for 29 years in my medical practice to help my patients feel relaxed, focused, and eradicate anxiety and depression, even to the point of sometimes having a panic attack disappear within minutes when inhaling these lipids. So you can appreciate how this can elevate your life, your medical practice, and improve the quality of your patient's life as well. By inhalation, they may be very effective because they bypass the blood-brain barrier. When you inhale them, not only do they start stimulating nerves, but they also physically get into the nerves and they are absorbed through that area. They can go to the cerebral cortex, thalamus, and limbic system and alleviate symptoms of also depression and insomnia. And this is another randomized study that showed that essential oils or lipids of high volatility and tissue penetration can be very effective in mood disorders. So you can appreciate how useful and helpful these can be for you. The chemical components that we mentioned already, the monoterpenes, can protect against stresses to the plant. Temperature variations, droughts, they protect against free radicals because they are antioxidants and anti-inflammatories. And they can fight infections. They're antibacterial, antiviral, antifungal, and antiparasitic. Some of them also may have benzene ring chemical components that also provide that volatility and deep tissue penetration. And as you can appreciate, in the area here where we see amygdala, they can stimulate the amygdala to become less active. And the amygdala has to do with the flight or fight response, stressful response, through the production of adrenaline, stimulation of adrenaline secretion by the adrenal gland. So this can be inhibited by these plant lipids. They diffuse quickly into the air. That's what volatility means, absorb into the body, as opposed to other oils such as coconut, almond, sesame seed. They're non-volatile and they don't get absorbed through the skin readily. They have the ability to dissolve plastics and petrochemicals, so they're useful to potentially remove these toxins from the body. And they also transport these petrochemicals and other contaminants out of the body, and they can also be analgesic. So for pain control, they can be very useful. They have an effect on the limbic system just by direct inhalation through the olfactory systems and nerves, as well as those pharmacological effects that the molecule itself may have in the brain. The sense of smell alerts us of the outside world. So the olfactory nerve is very important. That's why we have it right above the mouth, because we have to smell if the food we're eating is good for us or not, or if we're getting into an environment that is very healthy or unhealthy for us. And the olfactory nerves give signals to the limbic system. This is where we house emotions and memories and subconscious thoughts. So this inhalation of these lipids promote beneficial emotions and memories, which is what everybody wants. And it can also go to the thalamus and cortex to determine if the smell is pleasant or unpleasant. But very interestingly, the only sense that does not get processed by the thalamus is the smell. So it can go directly into the cortex to be processed consciously by the individual. That's how important the sense of smell is in us. It has been shown that these lipids have powerful antiviral activity. For example, it was studied by Tariq in 2019 against RNA and DNA viruses, herpes 1 and 2, dengue, influenza, polio, Junin, and Coxsackie virus. Antiviral oils, for example, are lavender, basil, oregano, rose, marjoram, cajeput, cypress, tea tree, eucalyptus, pine, myrrh, and others. To give you an example of how the tissue penetration is such an important property of these lipids. This is MRSA, methicillin-resistant Staphylococcus aureus, one of the worst infections that a human being can have, usually managed with antibiotics if you're lucky, but because they're resistant to many antibiotics, oftentimes you end up needing surgical resection of the lesion. And this infection is very serious, and it also may require, in addition to that, intravenous antibiotics. So it has been shown by randomized studies that MRSA can be eradicated by using melaleuca tea tree lipid of high volatility and tissue penetration. And not only that, not only skin lesions, but it also has been shown to penetrate into the bone for osteomyelitis, which is an infection of the bone. So these lipids can penetrate readily the skin and the bone, and they can do it in a very rapid manner. They can penetrate centimeters in minutes. So these properties are very helpful and useful for managing inflammations and infections of the skin and things that can be accessed through the skin like bones and other structures. During the pandemic of COVID-19, we did a mixture of several oils. It's called the Viral Victory Blend, and we sent it to a laboratory in the United States. And it was shown that a solution of 5% of these lipids and 95% of purified water sprayed 3 times at 6 inches from infected COVID-19 cells in a petri dish got rid of all the virus in less than 10 minutes. and it did not get rid of any of the infected cells. So it was found to be non-toxic to cells. This is very important because you can use many sprays to kill virus. But unfortunately, these sprays are also cytotoxic, meaning that they will kill the cells. They'll be toxic to our cells. This was not the case here. So this is very important. And also, we can reasonably assume, and we have seen it in the medical practice, that it manages most viruses that we have been dealing with in the practice effectively and rapidly in patients that have different types of infections. These oils have also been shown in randomized controlled studies, like in this one of Hansen in 2006, just by inhalation would reduce the symptoms of stress, depression, and anxiety. And it was noted in 32 studies with no side effects. We have developed 4 different blends of lipids of high volatility and tissue penetration to manage stress, depression, anxiety, and insomnia. And they are inhaled one at a time. First, the emotion blend, followed by the stress blend, followed by the meditation blend, and followed by the fem balance blend, has yielded this diminution, decrease of the symptoms of patients within minutes. So we recommend this for all patients that come into our practice. Before they go through the consultation they may need or evaluation, they go through this. We ask them, what is your stress level now from 0 to 10? And after inhaling these lipids for 5 to 7 minutes, we again ask him, what is your stress level from 0 to 10? And more than 90% of the patients will report an increased well-being sensation, decreasing their stress, and increasing their clarity. And that's what we want in our patients. And that's what we want in everybody, because that promotes communication, enjoyment of life, health, well-being. There are some randomized studies I will present that validate these uses and applications. For example, just by inhaling oil, there was a relief in pain in patients with menstrual pain. Of course, it can also be applied on the skin for a direct effect, but this was just by inhalation. Also, another study that was controlled that showed an inhaled lavender was effective in reducing pain on patients with menstrual bleeding. 150 patients seen in an ICU intensive care unit that were agitated were given lavender and citrus lipids to inhale, and it significantly reduced the anxiety immediately after inhaling 5 drops of each lipid versus saline for 30 minutes and 3 hours later. So the effect can be long-lasting as well, just by one application. Another randomized study that showed that knee pain from osteoarthritis can have decrease in the pain and improvement in mobility and activities by applying with a carrier oil in the area of the discomfort. Another randomized study showed that lavender can reduce insomnia and improve the sleep quality as measured by the Pittsburgh quality index, sleep quality index scale. It reduced the symptoms of insomnia 2.5 times, so 250% improvement on the sleep, and this was statistically significant. In patients with dementia, also the insomnia was improved by using lavender, chamomile, and valerian root lipids. And also there was a decrease in urine cortisol. That is an indicator of stress. So we see there are biochemical changes that occur. It's not only a direct stimulation or decrease of activity of a nerve, but is also through a biochemical effect that has been shown. These lipids can also increase the cognitive performance and mood. For example, peppermint increases alertness and ylang reduces it, but it's because it's calming and relaxing the person. So if you want relaxation, ylang. If you want increased alertness, peppermint. For memory and mood, these lipids have also shown to increase the alertness, the mood, and also memory, part of cognition. So inhaling sage, clary sage, has been shown in randomized studies to improve mood and memory. And who doesn't want to improve mood and memory? Everybody wants to improve our mood and memory. And that is why these lipids are so special, because they go to the root situation and condition that we want, which is get rid of anxiety, stress, depression, insomnia, and have better memories of our daily events. Sage by mouth, which is another very well-known lipid, also it's an analgesic, has cholinesterase inhibiting properties. So it improves the cognitive performance and mood in healthy adults, as seen in this study by Kennedy in 2001, randomized study. So it improved performance of secondary memory and attention tasks, most notably at the 1 hour post-dose testing session, and reduced mental fatigue and increased alertness, which were more pronounced in the 4 hour post-dose timing and testing. So as we can see, you can take it by mouth, you can inhale them, apply them around the ears for infection. In cold and cough symptoms, it has been shown that these lipids also in pediatric patients in a randomized study can decrease the cough of whatever cause. And the treatment group did significantly better than the ones that did not inhale the lipids. In agitation and dementia, also randomized studies have shown that it promotes calmness in these patients. Again, it acts by stimulating areas of the hippocampus that promote memory, nurturing, growth, and survival characteristics of an individual. And it may promote creation of new neurons, memory, or vice versa, not only by decreasing the stress, but also by promoting anti-inflammation and with unknown mechanisms, replication and regeneration of neurons. We may hypothesize, we think that it might be due partly because of stimulation through the non-temporal lobe pathways, that it's an integral part of how inhaled lipids of high volatility may create new neurons. We're not sure, but that's one supposedly possible pathway. For anxiety disorders, you can take lavender by mouth, and it can be effective in reducing symptoms of anxiety. And this was shown again in a randomized prospective double-blind study. And this lavender by mouth was compared to lorazepam for anxiety symptoms. And after 6 weeks, they had the same reduction of anxiety and sleep improvement. However, the lavender had no side effects. As you know, lorazepam can have side effects and also has a potential for addiction. So this is a way that we may be able to avoid using chemical substances that have side effects and potentials for addiction, for sleep, or for anxiety. Because these lipids have this potential. There was a study done by Wu in South Korea, randomized study, where they took Alzheimer's patients, and through the night, they had them inhale these lipids for 2 hours at a time each night. They did an MRI, magnetic resonance imaging scan of the brain in the beginning of the study and 6 months later, and they found that there was an increased diffusion capacity of the uncinate fasciculus. The uncinate fasciculus connects the temporal with the frontal lobe, and it has to do with memory. And this area becomes atrophied by the condition of Alzheimer's in patients with Alzheimer's. And this was regenerated, which was amazing, just by inhaling this every night. And at 6 months, that evaluation showed this. And it also showed that the memory and cognitive abilities in these patients with Alzheimer's improved 270%. So imagine that they remember 10 items in a test by the neurologist, and all of a sudden they remember 27 items after doing this. So this is quite amazing, because imagine if he can regenerate brain tissue, which is one of the toughest to regenerate, what else could these lipids regenerate? For pain control, we have been using lipids in patients, most of them with a diagnosis of cancer. An application of these lipids over the tumor areas, or other patients that didn't have cancer, over the head for headaches, back pain, shoulder, neck, knee pain, which are very commonly seen in patients that are doing exercise or have arthritis. There's an improvement of the pain in most of these patients. There was a 90% reduction or disappearance of pain, but the important thing is that it happened within 5 minutes with no side effects. So we want to promote that anti-inflammatory effect, analgesic effect, and these lipids also, we've seen that they can promote partial or total regeneration of the area with pain, depending how recent it is or how long-term it is. For fever control, you can spray peppermint in the back of the neck, and you may see a rapid drop in temperature of 2 to 5 degrees Fahrenheit within minutes. For air purification, because they have antibacterial and antifungal properties, these lipids can be very useful in terms of getting rid of pathogens or bacteria, viruses that cause respiratory tract infections. And this has been shown to decrease these microbials and increase the purity of the air by diffusing in the air. Also, it has been shown in patients with human papillomavirus that tea tree oil may be able to get rid of warts in the skin. And in patients that have herpes, application on the skin of the first signs of herpes may make the lesions not come out. If you have lesions, you can still apply it, and usually it will heal quicker than usual by applying lipids of high volatility. This blend in particular has lavender, eucalyptus, and myrrh, as being highly effective in our patients. Again, other oils like eucalyptus, pine needle, and citrus in 246 patients in a randomized study reduced the risk of exacerbation of chronic bronchitis during winter, which is great just by inhaling. Again, we see the properties of antimicrobial here and anti-inflammatory working for these patients. And another study of acute bronchitis in 676 patients showed that these lipids were more effective than placebo in improving those episodes. In patients that have stomach discomfort, also putting peppermint on the belly or taking it by mouth with a carrier oil has been shown to improve the symptoms of stomach upset. And in food poisoning, I've seen patients of mine that have the classical increasing intestinal transit and sounds, distension of the abdomen, chills and fever. Is a very uncomfortable situation when you have food poisoning. And 5 patients that had these symptoms, we put 3 to 5 drops of lavender in 8 ounces of water to sip it and also apply them on the abdomen. And all of them resolved all their symptoms of acute food poisoning within 20 to 30 minutes. It's very hard to do a randomized study in this because when you have food poisoning, there's no time to get into a study. It's either a doctor's visit or emergency room visit. So we have to manage this quickly. But this is very suggestive that this is a very useful tool for this particular situation. Also, a meta-analysis of irritable bowel syndrome showed that peppermint oil was very useful for these patients' symptoms. Again, the emotion blend in particular that has valerian root, marjoram, and lavender, inhale can deal with an anxiety and panic attack within minutes. Ylang is also very relaxing and can lower blood pressure more than 20 points in patients that inhale it that have hypertension. This should not be used in pregnant females or in patients with very low blood pressure. Basil can also improve ear pain and discomfort in patients that have otitis media, infection of the ears. All of the ones that we have managed this way have had improvement in pain within 20 minutes. And all were comfortable in 3 hours with no need for antibiotics. So this needs to be studied more. But what do you have to lose before going to the doctor's office or the emergency room? Have a kid with an infection of the ear or an adult? Use this application in the ear, the outside of the ear. You don't have to put it inside the ear. In the outside of the ear and the back of the ear several times. And you may be seeing this positive effects. Anise oil is where the Tamiflu comes from. And 5 drops orally every hour for flu symptoms may be able to improve symptoms in many of these patients. The meditation blend with vetiver and lavender is also very relaxing. Frankincense may be able to increase the blood flow of patients in the brain and may be able to repair damaged DNA. This is still on the study. For household use and eliminating, for example, mold, or if you want to increase the purity of the air in your house, House Blend 1 and House Blend 2 are recommended, as well as the 3. The House Blend 2, we may add oregano and thyme to improve and decrease the mold, but all of them will decrease mold and also bacteria and also virus in the air. This is a website that you can visit for more information, vmvoils.com. Thank you for your attention in this presentation, and I hope you have a great day.